The House stimulus package is here. 9 different committees in the United States House have spent the first part of the 117th Congress working on the first COVID-19 relief package of the Biden presidency. Their work is done, and the bill is ready to be assembled and advanced by the House Budget Committee this week for a vote by the full chamber. What's in the bill will undoubtedly change by the time it arrives in the Senate, where the votes of all 50 Democratic senators are needed to allow Vice President Harris to cast the tie-breaking vote. But the current proposal is fairly close to the package Biden proposed as a candidate, with one dramatic exception: no federal mandate for paid family medical or sick leave. The $2,000 checks candidate Biden promised are famously not in the bill. That being said, the $1,400 checks Biden said we would get after the election are in this bill for individuals making less than $75,000 a year, the same income thresholds that stimulus check receivers got under the Trump administration. A faster phase-out to the payments is also there, with payments decreasing by $56 for every $1,000 in income over the threshold, which means payments will zero out at $100,000 of income for individuals. The income and payment amounts are doubled for joint filers, and Americans will receive an additional $1,400 for children and adult dependents. That means that a family of 4 with less than $150,000 in income in either 2019 or 2020 would receive a $5,600 payment. The long overdue increase to the federal minimum wage made it to this package, a phased increase to $15 an hour by 2025. The debate around this provision is fierce, but the minimum wage hasn't gone up since 2009, and if a minimum wage is to be closer to a living wage, then this is a step in the right direction. The new child tax credit we first heard about a few weeks ago made it into this proposal. Parents would now receive $3,600 for children under 6 and $3,000 for those aged 7 to 17, an increase from the current $2,000 per child under the age of 17. And instead of the $1,400 maximum refund under current law, the next child tax credit would be fully refundable, which means more families at the bottom of the economic ladder would receive the payment and more money from it. The proposal extends a pair of pandemic unemployment benefits programs that benefit both traditional and non-traditional workers. These are the benefits that start expiring in mid-March. The plan would extend them to August 29 and increase the weekly federal boost to state benefits from $300 to $400. The bill includes $19.1 billion for state and local governments to be used to cover rent and utility costs for low-income households with unemployed members. There's also $11 billion for services like housing counseling and homeless services, and $10 billion for mortgage payment assistance for homeowners affected by the pandemic. Medicare for all it's not, but the House bill does make some marginal improvements to the American healthcare system. Those who purchase insurance on an Affordable Care Act marketplace will now have the cost capped at 8.5% of their income, down from the nearly 10% it is now. It would also make subsidies available to people who make more than the current cap of 400% of the federal poverty level, and eliminate premiums completely for some people with lower incomes who are receiving unemployment benefits. There's also COBRA 8 for laid-off workers that would cover 85% of premiums through September, and a 5% boost in matching funds for states that expand Medicaid, making healthcare costs a bit cheaper at a time when wallets are certainly tight. Among the issues that have most divided Democratic and Republican responses to the COVID-19 pandemic is federal aid to states whose budgets have been wrecked by the pandemic. This bill contains $350 billion for state, local, and tribal governments that follows $150 billion in aid approved last March and Democrats' failure in December to get $160 billion in state and local aid into the bill that passed just before the new year. When around people who don't live in your home, wear a mask, wash your hands, and stay at least 6 feet apart to protect yourself and prevent bringing COVID-19 into your home.